like we already have some questions, so.
I've got a question for Andrew.
Yes.
Thank you. This was a wonderful panel, every single talk. But on your last point on the marketing, I had heard that Mars, which spent a huge amount of money on Cosmos and other studies, that showed that the flavonoids, some of the flavonoids really seem to be helpful.
Yes.
That those products weren't doing that well in the market. But I don't know if it's true.
We're not. Yeah. I haven't researched it specifically, but certainly haven't heard a whole lot. I wonder if it's the maybe the very, very balanced coverage of the study. It wasn't sensationalized, maybe the way some had hoped. It was built up as being a blockbuster study, but I don't know that the results necessarily met everyone's hopes.
I mean, I can comment on it directly since I ran Cosmos, and so I mean, I can't speak for Mars directly, but they didn't really see this as an opportunity to necessarily sell a product. So their Cocoa Via products, you know, they didn't really market it much around the study results. And I think you're right, Andrew, that the results were presented the way we wrote the paper. We were actually much more guarded than we probably could have been. But there's a long backstory to that I'm not going to start going through with everyone right now. But at the same time, I think it's an interesting cautionary tale about when these studies do come out, whether large or small, how they are presented, and thinking more carefully about the question of, to your point that you mentioned, Andrew, about the question of guidelines versus claims. Health claims are such a tough hill to climb that I think that my impression in the at least for the flavin 3-ols, and this can certainly apply to the other bioactives, including lutein, you know, I think the guideline approach probably makes more intuitive sense, even though it might not be as directly economical for the companies involved.
I have a question for Janet. So for the framework development, both for the bioactives in food form as well as for the supplements, I'm thinking back to the guiding principles for the including chronic disease endpoints for setting DRI values. And so was that set of principles considered when developing the framework for bioactives? And I asked that because it was specifically opened to food substances. It was not specific to essential nutrients. It was supposed to open it up to other food substances as well.
Yes, that, you know, because that work was published and available, the team was reading that literature and then synthesizing those ideas and weaving that in. So yes.
This is really mostly for you, Karen. I'm interested in the framework choosing to separate foods from dietary supplements. Anecdotally, my impression is that when I look at the micronutrients that have equivalencies, whether niacin, folate, vitamin A, vitamin E, those are all categories that one, I think, probably evolved out of mandatory enrichment or fortification and were consistently used and available in the dietary supplement area. So by looking at bioavailability, they really didn't have to distinguish between foods and supplements. And as they measured what was the bioavailability and then used the appropriate form, chemical form and term for whichever product was in. So we heard today earlier about the sort of naturally present or the added presence for some of those nutrients in food databases. So would that be something that that committee would sort of revisit to sort of say, doesn't matter which place it goes. It just means that we actually need to have certain steps that are done so that the labeling of it is accurate and consumers are informed.
So let me try to unpack that question. So the framework for bioactives in foods has already been published, and the team decided not to, at that time, extend it to dietary supplement forms because the safety risks are a little bit different and need a little more care. And so, so now the team is adding and extending it to dietary supplements because there's a real need and a real void there's a real void of guidance for people using these 100,000, if that number's accurate, but that's what the FDA has been saying, 100,000 or 70,000 or whatever it is on the marketplace. So the team, so the other framework is already out and published, and this framework is similar and it has the same steps, but it has added bits and pieces related to problems that can happen with supplements and the high exposures that don't really happen as much with food. So there are sort of extra caveats that need to go with it. Not that supplements are unsafe and foods are safe. That's not the problem. It's just that the exposures are higher. And so there needs to be added sort of guardrails. But you mentioned something about labeling, which I didn't follow.
Well, it would seem to me we already have a history of sort of in nutrition of having set aside supplements. We don't see those as equal opportunities, but consumers don't feel that way. So to me, it would have been nice to see more of an integrated approach, that we've updated that one to also include supplements rather than saying we have one on foods. Now here's the one that's different on supplements, because you're right, it is exposure, but exposure comes through ULs. It doesn't matter which form. I mean, it's harder to get it in food, but the ULs, we don't have ULs for vitamins separate for supplements than we do for foods. It is a UL for the nutrient.
That's not true.
We do
We
for
might
rain.
need to, though. Looking back, I mean, the example I gave of the green tea, the level of EGCG that was safe from consuming brewed green tea is double that from consuming it in a bolus concentrated extract on an empty stomach. So, which is how it was commonly consumed. That's what was leading to liver toxicity, was consuming those supplements on an empty stomach was causing liver damage. And so now you actually do need a different UL for EGCG, depending on what conditions of use you're consuming it on. In that case. It may not apply to vitamins, but it's certainly in this case.
My question for Liz. I certainly appreciated the compelling body of science you shared, demonstrating that we are indeed ready for recommendations for lutein in healthy adults. But would you agree that those recommendations could also be applied to during pregnancy, lactation, and children?
I do, and it goes beyond vision. It goes into cognitive function as well. Because when you think about the brain, it's what's in back of the eyeball. So what's ever getting to the eyeballs get into the brain, and we've shown that the correlation between measures in the retina correlate very strongly with what's in the brain, and that makes sense because it's getting past that blood-brain barrier. It's going to go both places. Anyway, so in children, that data is accumulating both for visual function, because that's becoming more of a problem because of all the computer time. And it's the same thing with so it does go across the lifespan, not only for vision, but neural function as well in the brain. So that's what, in part why I think this guidance is really important, because most people aren't getting to where we think they should be.
All right, here we go. First off, thank you. That was a fantastic panel. I expect nothing less with so much Tufts representation up front there. Slight bias.
My father went to Tufts, so.
Well, there, like I said, I knew that. Like that hence the comment. So I guess I'm wondering, I don't know if this is just by virtue of the example that was chosen in lutein as the case study, but I'm curious because the example that you showed, Liz, I mean, a lot of that data was, lack of lutein leads to consequence X, right? Whereas the framework that I think Andrew was trying to describe as the addition of bioactive leads to benefit Y. And I'm curious if that's built into this framework that you're developing, or if that just happens to be a consequence of the example that you showed, at least in terms of the biological plausibility. It was like
Well, yeah, I think the biological plausibility, I mean, that's the reason for that study, to show that, yes, indeed, if you don't have it, you do have a consequence. And when you add it back, you get rid of that consequence. So, that's the point, was really the point being made about biological plausibility without it, because it's not a nutrient, so it's not considered essential yet. So that was the idea. And we see with the epidemiology, more is better. So we're seeing with visual function, with AMD prevention, with cognitive function, we're seeing that now, that more is better. So we're going both ways, from 0 to more. And in the framework, that's all part of the efficacy review section. Now, if you'd read that busy slide and all those words.
I think also, Eric, I think it's lutein probably checks both boxes, in my view, right? As vitamin L and as a bioactive that helps promote health, because it helps to make your eyes more resilient, basically. But I think the absence of a bioactive from the diet may not necessarily result in a problem, but the addition of it could help with resilience.
Yeah, it did in the monkeys, yeah, that it was a problem.
Well, that's why I said checks both boxes. I think it's a vitamin L and a bioactive, right?
But I guess that was my question, right? I wasn't sure if that was just by virtue of the example that was chosen, or if that's, I guess what I.
Because I had a slide, I took it out because I didn't want to go holding up the sign. But I didn't. I took it out because I knew Liz was going to cover it, and it was a study of Chinese students having sat in front of a computer for like a year, and they were supplementing with lutein versus a placebo, and the supplemented ones had better eye performance, better recovery. So it was not looking at chronic disease endpoint or essentiality, it was more looking at resilience. So I think lutein checks both boxes.
And that's why it's a good case study, because it's one thing. We all know what it is, and it's going to these health outcomes that we all can relate to. I mean, look at how many of us are wearing glasses, right? So it's a really good case study to move forward with these bioactives and providing guidance.
Back to Michael's question though, and Howie's here, and there's some other epidemiologists here who may be able to answer it, but the thing that's puzzling me, has always puzzled me, is how we put the two things together. In other words, you have a food recommendation and then you have a supplement recommendation. But total exposure is what really is the important thing in terms of, the body doesn't know which it is. So how does one make a reasonable, understandable recommendation? Maybe the epidemiologists know how to do that. You must know something.
Sometimes I do. Sure, put me on the spot.
Like it is.
It's interesting.
Sorry.
Oh, yeah, no, sorry. If I can just talk loudly, it's fine.
Yes, project.
Yes, I mean, like from an epidemiological standpoint, when we're looking at dietary patterns, we're always going to combine, albeit crudely, what you're getting from the diet versus supplement. You're going to put those together without any appreciation or context about like what form it's in. Are you actually absorbing it? What are you having it with? So it's a very naive approach. But just as a measure of total exposure, it's critical to at least capture both, especially given the fact that as much as people I feel like sometimes people, there's a lot of supplement deniers out there, shall I say, and that people think it's not out there, but it's actually more out there than people appreciate. So I think that's one part of it. The second part of it is that, you know, the food supplement conundrum is going to continue to play nutrition science forever, whether we like it or not. And that's not necessarily a bad thing. I think the key is how those two can actually not really interact in the biological sense, but how those play off each other to try to enhance health. Because we know that, you know, lutein is a great example where we know that dietary intake is low, and supplementation can actually push people out of these low percentiles and put them into a range where there could be not just prevention of deficiency, shall we say, but also added benefit, whether it's eye disease or cognition or otherwise. So I think, and it also gets manifested in, for example, in the dietary guidelines that are updated every 5 years. You know, obviously it's a function sometimes of who's on those panels. Of course, there's politics, which we don't need to dive into. Really? But I think what's interesting about it is that they basically don't want, you know, there's a resistance obviously to acknowledge how supplementation may or may not have a role on a plate. And you know, there's a reason why the plate is the visual, and it's because it's a focus on food. But yet it's actually, again, getting back to the supplement denying, it's denying what's actually happening, at least not just in the United States, but even more globally. So we need to figure out, and I'm not just like pro-supplement necessarily. To me, it's about how do we put nutrition and supplementation together and and figure out how to move forward with it, you know, in the best way we can. So.
A little pushback from being on those panels of why you do food first is because we don't think we know enough to say you can get your nutrients and chemicals, everything from supplements. And so food comes with a package of nutrients, you know, unless you're going for snacks that we're trying to limit, you know? But the whole package of bioactives and chemicals is the patterns we care.
No. But if I stop in for my morning smoothie with a shot of this or that added to it, is that a food or a supplement? Or if I make it at home in my blender and put a shot of this or that into it, and there's a lot of people doing that.
What would you say?
I think it's irrelevant. I think that it's my total exposure that matters. Now, I would.
Yeah, but that's different than making recommendations.
Yeah, so I agree from the dietary recommendation standpoint, Connie, I completely agree with the approach that's undertaken. I think the hard part for me is that, again, I'm not saying that supplements should necessarily be part of that, because it's already complicated and complex enough to get that together. But it's being done in the absence of it completely without understanding where that's being, you know, how is that impacting dietary status in the context of the recommendations that come out. So does the work that gets done there, is it important? Of course it is. And I don't think we have to necessarily get in the way of that process. It's just a matter of how it's being applied out to the public too.
Maybe that's what your working group is partly trying to make progress.
Not sure exactly, I followed that, but the framework is taking into account intake from both food and supplements. So, but then back to Andrew's example about the green tea, the exposure, safe exposure levels are
Very
different. So,
Yeah, strikingly different in that case.
But also on that, it's not one single supplement versus one single natural source. I mean, the way I drink tea is a couple of dips of a tea bag compared to others that let it soak until it's completely black. You can't say drinking tea is equivalent.
And that's part of the conditions of use, yeah. But how far can we drill down? How long you steep your tea? It's true. It'll extract more EGCG if you let it sit longer.
And I would guess
Even in the green tea example, you're taking a bolus without anything else.
Right.
So you don't know what the interaction would be if you were taking it in a smoothie.
Yep.
As a supplement. And so the problem with controlled experiments is they're controlled.
So,
For the sake of illustrating the difference, it's extremes, right? That allows us to illustrate the difference, but the reality is some mixture of things in between.
so we're a little time limited. I know we want to get to cocktails. So I would like to ask the panel for just a few closing statements, key takeaways, and then I'll bring Connie and Roger up to the stage. Any closing
Well,
statements?
I'm glad that Ilse wanted to look at lutein as far as being a case study for a bioactive, because I do believe it has a lot of support for moving forward, that it's going to be easier than the flavin threols, because it's that one thing along with the xanthan, and we do have the human data to support biological plausibility and efficacy.
And I'm grateful to be part of this group that's working on this framework, because I think it's a good starting point. There are clear differences that we need to address. I don't think it answers everything, but I think it's a good starting point to separate out some of the supplement specific issues.
And I think it's great that Ilse has supported this, this program this initiative, because I think that that framework does need to be in place, because it has been a complicated experience trying to pull all this together, as you can hear from all the points. And if we've got that framework in place, it's going to facilitate, hopefully, the development of that guidance, which is going to help. It's going to help industry. And I do want to make a plug for chronic disease, because we're not waiting for the chronic diseases to develop, but rather we're looking at the biomarkers, which we can affect in short periods of time. So I think by looking at resilience and also chronic disease biomarkers, and being able to, when that evidence comes together like it has for lutein, because even with lutein, maybe not just through food, but maybe with the supplement too, those people are going to be able to protect those eyes. Age-related macular degeneration is the #1 cause of blindness in the aged. It's very, very common. I'm sure some of your family members have it. And so it's important to get those messages out there. And if these expert panels are having that, or being able to facilitate that for lutein and other bioactives, as the evidence base grows, this project and what Ilse is supporting is really going to make a difference.
Thank you so much for this session.